that there was a question and answer period on the agenda instead of the questions to wanted preemptive. Yeah, it's kind of a preemptive strike here. So we're glad for that. So we'll just walk through these, and some of these I'm going to defer to Clement and Dan to say, what's going on. So the first question was, will pre-coordinating units of measure into the clinical and survey LOINC questions be allowed? So, for instance, birth weight in grams, blood loss in milliliters. And the answer is no.
I guess we, like our usual no's, I guess we would always reconsider something if there was a good use case. So normally what would happen with things like this is that wouldn't make unique LOINC codes for different units of measure, but you would certainly be welcome to specify the units of measure that you wanted to use in an implementation guide or any other mechanism that you wanted to use to specify the units of measure. But
you have a particularly complicated problem, not a complicated problem, but I think we could say in our description that given units were preferred by somebody. The model that we're working toward for the expanded panel model, which is forms, we could do a specific unit in a specific. You have some additional issues, not you, we. So for birth weight, we maybe should have a different birth weight in the kilogram scale than we do in the pounds and ounces scale, the ounces scale. The problem with ounces is pounds, because there's no really way to express that elegantly. And what people say is 1 pound 3 ounces. That's the other alternative. So, or if you made a term that was CDC's baby weight, that may be one that could have a specific term. We are working toward preferred units empirically. We're looking at, I think we got 12 or so different labs with LOINC codes to find out naturally what's the variation. And for a lot of tests, the only variation is the strength. It's really the same unit. So we would probably end up with a preferred term for a lot of things. So, does that help?
Yes, I think normally in the HL7 we expect the units to come in OBX6, but this is a situation where there are certain protocols like National Health Safety Network. They wanted to specify in the survey LOINC saying that we're expecting this to be in the grams. As you said, I think they also have an option in CDA solution. They may explain these grams in the conformance statements.
Well, say again, why don't you send the whole form and then we can...
Yeah, we're going to review the forms tomorrow. Interesting.
That's what everybody reports in a hospital, is 1,000 milligram baby. At certain levels they have tremendous complications.
Okay. So your second question, LOINC scale, yes, no, unknown, ordinal or nominal. And in a sense, I guess I would ask, normally that would be, think of that as ordinal. Because you can put at least yes and no in order. So it makes it a little hard with unknown. Because really should have, if you're going to treat it as ordinal, you have to agree amongst the users what is the order. Where does unknown come? Is unknown, less than no, or is it greater than no and less than yes?
There's a flavor of unknown.
Yeah, it's really sort of just in another space. It's yes and no that you can put in order.
So we have the similar situation stand with the susceptibility results or any kind of lab test results, positive, negative, indeterminate, inconclusive, and any other flavors of null.
Well, indeterminate, like in VDRL, is not a null. Indeterminate says it's between positive and negative.
So those, yeah. So positive, indeterminate, negative is clearly an ordinal.
Okay.
This is null, like not as.
So in a sense, we would encourage you not to put into your value list all of the flavors of no. Handle that by a different mechanism. Then you're left with things that you can put all in ordinal order.
So, what are your real examples?
Oh, I mean, most of the survey questions, they have these three responses. I mean, yes, no, unknown. They'll ask all the information in the question, heavily loaded question, but they expect the answers to be yes, no, unknown. I mean, this plays major role in the survey LOINC.
We modeled them as ordinal. I think all the MPS ones are.
Okay.
At this
We think of the unknown as being on a different axis. Not really a value in the space, it's just it didn't get reported.
So the answer is we would treat yes, no, unknown as ordinal.
But you know what we'd really like to do is to get you to do that question differently. And I know all the arguments. And that is to say, have the question be, do you have any of the following? To answer all that apply, one of the answers is none. Don't know anything. Because I think when people answer these things, they just go down. They're not giving you any more information by dealing with that unknown thing. My bet is, unless there's real data on that.
Okay?
Okay, thank you.
You have more comments?
No, Stan.
Number 3, explain the use of controls of courtesy. So, as we talked about in the tutorial part, XXX was an early way of doing what we now do in curly braces. So anything new that we're creating, and actually as we have time, go through the old ones and change the XXXs to be a curly braces style. But again, what the meaning is the information that might have been specified by the XXX or inside the braces is information that either is unspecified in the message or is specified in the message in a different field, in some different part of the message. And so, where there's a setting example, it says that setting. Either we don't care about the setting, so if it was a consultation document, it could just be a consultation, and we don't know whether it was a consultation in an inpatient environment or an outpatient environment. Or you could use that same code with the curly brace setting, and you could have a separate field in the message that said the setting was an outpatient setting. So. Same thing for provider, body size, etc.
Stan, one clarification on that one is, does the need to be a coded vocabulary that needs to already exist in LOINC, or can it be any value that we can substitute in the message? Like, for example, setting you have already defined in the document sections. These are the starting set of settings.
The answer is no. It doesn't have to be. It doesn't have to be a known list in LOINC.
Okay.
Someday we would like them to be, and I think we have machinery where we can connect them up that way. But right now, it's just a name, and it doesn't have a fully defined list associated with that item. In most cases, so
Okay.
it can just be a name. Right now, it's an imprecise name for the set of things that could go there.
But if you do that, put a very long description in, because there's lots of confusion. Now, if they don't know the semantics of that word, and we haven't explained it, the more I do this, the more I think the modeling is useless if you don't have a big description, because it can't say enough clear to everybody. The first thing is say what it is, if you just explicitly and as fully in English as you can. Make sure the modeling will everyone else to know. But don't depend just on filling in the blanks. You don't know what it means.
Okay, thank you.
Okay. Number 4, question grouping clinical LOINC panel versus survey LOINC. Clarify the criteria used.
You have kind of explained it during the tutorial, Stan, I think.
What's that? What did you say, Sundar?
No, actually, you kind of explained during the tutorial.
Oh, okay. So you're okay with that one?
Yes.
Well, actually, surveys are a special case of panels for an extended case of panel.
Yeah. Okay, comment on the reusability of clinical LOINC questions, survey LOINC questions. These clinical lab LOINC questions, survey LOINC. Yeah. And can the organization or program balance specific questions by clinical LOINC? Yeah. So, again, there's not survey LOINC again is really just a specialized use of the panel structure, so it's all the same thing, and you can combine clinical or lab LOINC into a panel. Anything that's in LOINC you can put into a panel, or you can put into a survey.
The main thing different on surveys is the answer lists are often fixed. That survey instrument designed, less validated, can't mess with the answer list, same question. At least not LOINC. Tell you one on your own. Actually, well, some of them you can't cheat. They say you can't change it.
Number 6, what are the benefits of using survey LOINC over the local code system? I don't think I understand that question.
So for the survey LOINC, I mean, we have a lot of forms in the CDC. They already have, most of these questions have individual identifiers that refers to that particular data element referring to that in the form. So what advantage do we get by putting those questions exactly in the survey LOINC? I mean, you're going to get a unique identifier for each one of them. So just kind of trying to understand what are the advantages of using the survey LOINC.
Working with Medicare right now for the new form called CARE. To get it put into LOINC, so that they themselves can see, they look across their forms, they got the same stuff done differently. So we put in one common structure, try to shape the future, so they don't keep making, I'm sure you got the same situation.
Yes.
3,000 forms. Same thing might be asked 100 different ways in those 3,000 forms. The idea is going forward, you kind of try to be more formal and reuse questions instead of using the same old one. When we're doing MDS, OASIS, a bunch of government forms, now reusing a few fields variables because they are the same on both forms.
Answer your question, or
Yes.
I also comment just by having lots of different forms of structure that implement kind of a common all form. Going out.
okay, number 7, comment limitation of government. Survey. Think more about what your question is.
These are kind of one of the advantages we see is actually if you put it in the survey LOINC, and it's there in the LOINC code system, it's distributed, and I think that's what one of the advantages we see. And if the EMR or if any of the vendor products already have the LOINC, and then obviously they can actually easily get access to these forms as an orderable item or any kind of things, they can get the whole forms. So that's what that's one of the advantages of seeing using the survey LOINC. I just wanted, and also it seems to be once you have the survey LOINC, you also have, it's platform independent or any kind of thing, so it can be used in XForms or CDA or any kind of HL7 versions. So we wanted to know what others have done, or just wanted to know what people who have done the survey LOINC, how they have used it, or kind of how they have implemented these things. Just a couple of examples would be sufficient enough.
We're doing, the schools we're building an MLM will generate a web screen to capture the data that's built into LOINC forms. We're not calling it survey LOINC, but this, send it a fully flipped out panel of column forms. Those then you can actually capture your data through a web form using some Ruby on Rails. showed it at CEC, got a lot of people who got excited about it. I know there's a big X Forms effort the way CEC. I also heard background that
Question number 8, survey going, answer for this and use other vocabulary standards. Other vocabulary standards. Other vocabulary. So say more about what you're thinking.
Just for the answer list, we wanted to try to use a standard value set recommended by the CHI. Like if for microorganisms, we want to expect to use a SNOMED codes. So we have a survey form that was asking pathogens identified, and the answer list we expect to be we have I think 950 microorganisms that the NHSN program is interested in. So it's really a subset of microorganisms from SNOMED. So how do we actually put that one if you're having a survey LOINC for that particular form? The answer list, we kind of expecting the users to use the SNOMED codes, and at the same time I think we have the licensing issue, putting the answer list of SNOMED code inside the survey LOINC.
name the code system. Talking about a subset, you're going to have to have a reference someplace that's got the subset, and I think you're leaving something on it. It would probably be an OID. Give the name and an OID. Reference. So the LOINC can't carry around everybody's coding systems. They're really big external coding systems, whether it's license issues or just physics. But we could link, we can identify them and link to them. User could link to them.
But I think there are two situations, and there are questions where LOINC would probably not bind to a specific value set for that item. They would expect that binding to happen, implementation guide or something that you specified. And then there are other cases where it is in fact a very formal thing, and you're doing the binding with the LOINC code because essentially that question is bound to that exact value set. So, if it is an exact value set and it is in fact bound in the instrument itself, then I think we can come up with mechanisms to support for the binding to that external value set. I don't know if we've done that yet.
Well, there are field support, and tomorrow when we discuss the database, we'll try to see how we can overlap.
We're open to figuring out how we can do, a nice representation of formal binding. But I think there will always be, some things in LOINC that aren't bound to the value set. The expectation is that the binding would happen, implementation guidance. So that would be up to you to, or you can follow the HL7 standard that's been proposed by how you represent the binding to that question, value set.
Okay. Thank you, Stan.
Well-known request, hopefully request panels and that supported long answer.
Got a nice set of questions and pointers about that, and we know that we need better ways to have folks request. That's on the list.
But, in the meantime, how would you do anything with access? And as we learn how to do this, it might be best to don't pre-specify. And always, one of the most valuable things is actually having the whole form as it's finished, too. We found out with Medicare that what the database said isn't what the form said. They really put transformation the level on what they stuck in the database. So even the database isn't found through. So if you have a form, developed as a Word document or whatever, you send that, send a table, put it in, work with that. So we have a formal way to submit code, but then we don't get enough. Get the package inserts that we often see. So we need dialogue to look at things typically. But Kathy's been pounding on John Hook to do a storage. Internally used.
Okay, thank you.
Welcome.
I think that's a very thoughtful set of questions.
Thank you.
Okay. Any other questions? We'll conclude. Well,